All right. Well, good morning, everybody. Some of you may know I'm Tony from Mercy Perrysburg Family Medicine Residency. And as we do the third Wednesday of each month, give a talk on a different medical topic. Today, we're going to talk about reducing our risk of falls. There's a lot of things that we get concerned about as we get older. And we've talked a lot about those on different topics over the course of the year. But one of the things that certainly is at the forefront is reducing our risk of falls. Um, because sometimes we're lucky enough to escape with no injury, or we may have that fall result in something that's a life-changing event, which, for a couple of years ago happened to my father-in-law. He was merely getting out of his car, going in to vote in March, and tripped over the little lip of concrete between the parking lot and the sidewalk and ended up fracturing his neck. And now has all of his cervical neck fused together. And so it has limited his independence and he has to rely on some people to do some things. So we never know in the blink of an eye. Could it have been prevented? Maybe yes, maybe no. Maybe if he was a little bit more conscious of, his environment and how he was walking, but you can't really place blame on anybody. The take home message is just trying to be vigilant of our surroundings and what we're doing at any given moment. I always like to start with some statistics because I think it really drives home just how frequent these things happen. So 1 in every 3 individuals over the age of 65 are going to experience a fall in their lifetime. Um, there's about 14 million, maybe 15 million people a year that this happens. 87% of those people, so 87 out of 100, there's going to be a result, some type of fracture. There's the 13 fortunate few, but there are those that have fractures. A lot of times this can be, we talked about hand fractures, we can talk about finger dislocations, but a lot of times these result in hip fractures. And as we get older and we have a hip fracture, those develop greater complications for individuals, so things like pneumonia, and you can pass away, you can die. Every Thursday, the Toledo Blade comes out with their coroner rulings, and I read them I read them every week. I read every single obituary, I read every single coroner ruling. And the interesting thing that I see is about a third of those coroner rulings are people who have died as a result of complications from a fall. Mm-hmm. It could be falling out of bed in a nursing home, it could be falling down the steps, it could be tripping and falling over, an obstacle in the home, but there are a lot of people that unfortunately is the outcome. 43,000 older adults die as a result of a preventable fall, and we kind of talked about that a little bit. But the two things that stand out to me are 2/3 of individuals who have fallen are going to have another fall within 6 months. Mm-hmm. And the risk, my take home message is the number one risk for a fall is a previous fall. So if you've had a fall, chances are you're going to fall again. So you need to be extra vigilant of things. And it's not at the time, it's not in the forefront of our mind when we get up to go to the bathroom in the middle of the night or go to answer the door or go to grab our cell phone or something like that. But falls are preventable, and we're going to talk a little bit about that. There's a lot of different things that happen. We call these risk factors that can contribute to a fall. Like I said, history of a previous fall, being over the age of 65, balance problems and muscle weakness. We're just not as active, or we're starting to develop osteoporosis, our decrease in bone health. We're maybe we're not going to the doctor as often to kind of stay up on things. We're not taking vitamins and supplements that might be recommended. Older individuals start to develop the possible risk of dementia. or delirium. Dementia and delirium are different. Delirium tends to be more acute or sudden and short term, where you're just not familiar with your surroundings. And of course, we all know what dementia is. Arthritis and joint pain start to creep up. Um, Things like diabetes, because you're having problems with diabetes, not only affects our kidneys, but affects our vision, affects our nerve health. You know, you may not have as great what we call neuropathy feeling down in your lower limbs. Um, Dizziness or vertigo, they're kind of one and the same, but people who get out of bed quickly in the middle of the night because they have to go pee, and all of a sudden they stand up and they're like, whoa. Or, you know, you're in the shower and you're soaping yourself down and you drop the soap and you bend down and you go to stand up and you're like, whoa, you know, I get a little dizzy. So, um, those are times that people are going to fall. Obviously, dehydration. You know, we're talking about the summer heat right now, and making sure that we're keeping our bodies cool, making sure that we're staying well hydrated, making sure that we're decreasing alcohol use. Certainly, any type of trying to stop smoking. Even acute illnesses right now are going to cause a lot of problems. We have the issue going on right now with all the vegetables and fruits and that, but also norovirus is going around right now. So some people are getting sick, having the like 24-hour bug, and they're like, "Wow, I think I might have had this other thing." But so there's a lot of that going on right now. Those types of acute illnesses can result in dehydration and you know, causing dizziness, and again creating falls. So there's this little chain of events that happens. We talked about diabetes, we talked about numbness in feet and legs, multiple medications. A lot of people don't realize that, number one, certain medications can cause dizziness, but number two, combinations of medications, drug interactions, or something called polypharmacy, which is a fancy way of saying people who are on medication, 5 or more medications on a daily basis. Um, Use of cane or a walker. Use of cane or a walker is going to help reduce falls, but if you don't have a cane or a walker that's in good condition or has been fitted to your size or something like that, and you're not using it properly, can reduce or can certainly result in falls. And then we've talked about visual and hearing impairment in other talks, but those certainly can be a problem as well. Preventing falls is probably, you know, the premise of this talk. And I think the first thing is going back to page 1 and knowing what all your risk factors are, seeing where you're at in that process. The other thing is sometimes I give these talks at senior living residences, but you know, places like the Wood County Committee on Aging and the Bowling Green Senior Center, a lot of individuals are residing in their own homes. So we need to think about what are the hazards in our homes? Do we have throw rugs? Do we have older homes that have uneven floors? Do we have electrical cords or extension cords or telephone cords running across our floor that can cause trip hazards? How is the lighting in our home? Do we have pets? I've worked in the emergency room for a few years and earlier in my career, and I had a lot of people come in because they went to go answer the telephone or answer the door, and they forgot that their pet was at their, you know, or at their feet or something like that. And the other thing is throw rugs. I would constantly have this battle with my mom, who wanted to have throw rugs because she wanted to keep her main carpet nice and clean and everything. And, you know, we put these throw rugs to kind of walk across those, but those can be a huge trip hazard. And I've seen that way too many times. So we just need to think about our surroundings and what can we do to minimize, you know, those potential hazards. The other thing is, another argument I used to have with my mom is, you know, she was in her late 80s, still living at home, and she would have certain bowls and certain cups, and she didn't put them on the first, on the first shelf that's easily reachable. She'd always put them up here, and I'd be like, Mom, why are you use those bowls, you use those cups every single day? Well, that's the way I've always done it. So trying to break some of those old habits. And if you have a bowl or a cup or something, that you use frequently, plates and that, just leaving them out on the counter. I know we like to keep things neat and tidy, but if it helps to retrain your brain and make things a little bit easier for you, that's, something to consider. We talked about medications, multiple medications and the side effects. A lot of them cause sleepiness, fatigue, dizziness, could cause drops in your blood pressure. And a lot of people don't realize that some of these medications can also cause dehydration and confusion. So if you think about those types of medications coupled with the hot temperatures that we've been having and the further risk for dehydration, there's that further increase for falls. Um, Maintaining both bone health. We talked, I mentioned a little bit earlier about osteoporosis and osteopenia, which is you have healthy bones, you have osteopenia, which is in the middle, and then you have osteoporosis. And sometimes people don't realize that they have issues related to bone health unless you've been having those frequent visits with your physician, that you've had some lab work done, that you've had a DEXA scan done. DEXA scan is a fairly invasive way of, it's almost like an x-ray to see how well your bone health is. But getting regular exercise, maybe trying to get in the mindset of, after some of these talks or before some of these talks, going across the hall and participating in some of the chair aerobics or cardio drumming or Tai Chi is probably one of the best ones that you can do. I'm certainly not recommending one over another, but it helps to, it's not very strenuous, but it's going to certainly help with balance. Even line dancing, I don't know if they do line dancing here.
We do some dance classes
Okay.
that some of them have some line dances in them.
Gotcha. All right. So even doing something like that. I mentioned about frequent osteoporosis screenings, making sure that you're having a conversation with your physician about supplements, vitamin D and calcium. It's best to take those together because one of those will help the other to absorb a little bit better. So trying to take one without the other may not necessarily be the best. Um, and then making sure that we're getting appropriate treatment for osteoporosis if we do have it. Sometimes there's daily pills, there's weekly pills, there's monthly, but there's yearly injections because some people may not be able to tolerate these pills, or your body may not be absorbing them properly. So we might need to take the next level in terms of injections or IVs or something like that. Obviously, having an annual wellness a Medicare annual wellness exam with your primary care physician, at which time they should be talking to you about, hey, when was your last eye exam? And Medicare requires the physicians to get those reports from whoever your optometrist is or whatever, and getting that into your medical chart so that we can make sure that we are taking care of the whole person, and that we are addressing any type of visual acuity issues. I mentioned it earlier about houses, just making sure that you have proper lighting, especially at night. I'm a person that needs a night light. I got to get up a couple of times during the night to use the restroom, and I make sure I've lived in this house forever, but making sure that you have a night light to help guide you. I always tell the story of my wife's family has a cottage in Indiana and it's pitch black, and I had to get up in the middle of the night, and I was in a different bedroom, and I got out in the hallway and I'm like, okay, now I don't know where the bathroom is and I don't know where the bedroom is. I stood there for a few minutes And what did I do? I made my way back to the bedroom, put my glasses on, got back in the same place in the hallway, half asleep, not thinking that having glasses on in the dark was going to improve my vision. So now I have to go to the bathroom even worse than I did the first time. And eventually I made it, but I can guarantee you that next morning we took care of the problem, put a night light on so that I didn't trip over anything. Using assisted devices. A lot of times we struggle with having to use a cane or a walker because we feel like it's impeding our independence or something like that. In my opinion, it's like having a best friend with you, somebody that's going to try and help keep you a little bit more safe. Medicare covers one assisted ambulatory device for you. So if you're going to need something, if you're having a conversation with your physician, you need to think about what's going to be best for you. Is it a cane? Is it a walker? Is it a wheelchair? But try and make sure that it is something that's going to best suit you, not just now, but moving forward. Canes can be fairly inexpensive if you purchase them on your own. A walker might be a little bit more of the way to go in terms of Medicare coverage. There's basic walkers and then there's Cadillac versions rolling around. So finding out what's best for you, finding out what your medical plan will cover, and then they will allow you to replace it after 5 years, but they'll also help with maintenance of that if something needs to be repaired. But making sure again that it's the proper height, that the wheels are in good condition, that if you're using a cane, single cane or quad cane, those are metal. They typically have the rubber stops underneath, but if you're using it through the parking lot and other surfaces, that you are checking the bottom of those, making sure that the rubber's still in good condition. Otherwise, if you're putting it on a wet floor, metal on a wet floor is just going to slip and we're going to, have a worse condition. Trying to make sure a lot of accidents happen in the bathroom related to falls. So making sure that we have a toilet seat riser that is not covered by Medicare. A lot of bathroom equipment is not covered by Medicare, but having things like grab bars or a shower chair or possibly trying to get the handheld wand in the shower to help us. The other thing that I tell people that really helps a lot now as we get older is getting yourself one of those grab
The claws thing.
Thank you.
Yeah.
So, in case you do drop something that you don't have to bend down and try and pick it up. If you do get one of those, making sure that I would test it out. Do you have the grip strength? Some of them, I just went to Shipshewana a couple weeks ago, the flea market, and I was amazed at how many different vendors were selling these grab bars. But some of them, you need to have a little bit more grip strength to be able to open and close them. The other thing is it might be fairly easy, but it doesn't lift anything of weight. So you might have one of those full pop cans, and it won't necessarily pick it up because it's not a good material or whatever. So you need to kind of shop around and not all grab bars are the same. I'll just say that. And assess your risk. Again, making sure that you try and do every single year the Medicare annual wellness visit. That is a free visit through your primary care physician. You don't get charged for that, but you can't talk about any of your other medical issues during that time. So if you want to talk about your blood pressure, your aches and pains, or your diabetes or something, you have to reschedule. You have to schedule another appointment for that. There's certain things that they look for during the medical annual wellness visit. On the last page is a questionnaire that I just encourage people to think and answer these questions honestly. And it helps to assess your risk for falls. And if you've answered yes to 2 or more, then you have an increased risk of falling. So even further more reason to get with your primary care physician to kind of talk about what's going on? How can we prevent falls? What do we need to do to fine tune you above and beyond some of the things we talked about? So that's about it in a nutshell. Hopefully you found some of this to be either a good review or beneficial. And I'll stick around for a couple of minutes in case you have any personal questions. Thank you.
My
Yes.
observation, especially watching my mother and aunts
Mhm.
at that age, is that one of the reasons they can be scared of falling is because they've already fallen.
Exactly.
Right, and then they walk carefully so that they don't take bigger steps with strides, so their toes don't come up, so they're more apt to fall. It's
Yeah.
I told my mom after she recovered from 2 partial hip replacements at my house, and when I walked with her learning to walk again, I said, walk like a farmhand. She was a farm wife. I mean, and she laughed, but yeah, it was important to take a big enough step so that your toe comes up.
Well, the other thing too is sometimes they tell you that to walk like a duck or walk like a penguin. I mean, so you kind of have your feet out a little bit like this and you kind of walk a little bit more. I don't know. There's different schools of thought, but you know, my mom fell because she got out of bed and now she's over here and she needs to get over there and she's trying to reach to get over here and then falls and then, you know, hits her head on her dresser and next thing you know.
With your assessment, it doesn't count if you just carried a cane so that you don't, I mean, so you can look at the world outside.
Yeah,
And so you can reach things on the top shelf of this,
you might
and
as
so
well.
you can shake the cane if the car doesn't stop at the corner.
Multi-purpose, multi-purpose.
I don't think it counts too often if you can walk without it.
You made me think of something about at the store. There was an older lady there was something on the top shelf. And she looked at me, she goes, do you think you can help me? I go, yeah, if you bend down and go this way, I'll. She just looked at me and I go, I'm kidding. So I thought it was
I
funny.
saw people all the time.
She did
say
in the
you're
moment,
tall.
so.
Will you get that for me?
Anyway,
Mhm.
next month, our talks on vitamins and supplements, Dr. Chung will be here. So I thank you for your time. I wish all of you a safe, happy, healthy, cool month. Let's get through these temps
Yeah.
and get back to enjoying summer the way we would like to. Obviously, work's trying to reach me. So thank you very much.
Thank
Appreciate
you.
it.